In previous videos, we have reviewed the indications, contraindications, method, and analysis of CSF in lumbar puncture in the critical care. In this video, we will review the important subject of complications of lumbar puncture. Complications of lumbar puncture include the following: cerebral herniation, post-dural puncture headache, bleeding, infection, and lastly, persistent low back pain. Cerebral herniation. As discussed, this complication is extremely uncommon. In the opinion of the author, standard measures to control ICP, pending imaging, would be required in the event of a patient developing signs of impending brainstem herniation after lumbar puncture. Post-dural puncture headache. Post-dural puncture headache is a postural headache, typically frontal or occipital, occurring with onset of 24 to 48 hours after the procedure, and it occurs in approximately 10 to 40% of patients. Post-dural puncture headache is thought to be due to low CSF pressure from reduced volume, resulting from ongoing leakage through the dural rent in excess of the rate of CSF production. Risk factors for this include a larger needle gauge and the orientation of a needle. As a larger needle gauge is required for diagnostic purposes, as previously discussed, the risk of post-dural puncture headache is potentially higher in ICU than in anaesthetic practice. Inserting the needle with the bevel held in the sagittal plane may reduce the risk, as may the use of specially designed Quincke needles. Interestingly, post-dural puncture headache is not related to the CSF volume removed at the time of the procedure. The management of post-dural puncture headache has not been elucidated in intensive care patients. However, in the anaesthesia population, initially conservative management with simple analgesia is advocated. If this fails, epidural blood patch may be applied on 1 or 2 occasions if necessary, usually with satisfactory results. Blood patch is thought to work by a combination of volume replacement tamponading the ongoing CSF leak, and secondly, sealing of the hole from the blood clot. Bleeding. Serious bleeding resulting in cord compromise is thought to occur in less than 1% of patients from early studies post-lumbar puncture. Persistent back pain or neurological findings post-procedure should prompt the investigation for this complication. However, in ICU patients, these findings are often clouded by the fact that they are sedated, so a high index of suspicion is required if there are a change in neurological signs. Urgent surgical decompression may be required after imaging in such cases. Infection. Meningitis from diagnostic LP is extremely uncommon. Interestingly, the microbiological profile of organisms in suspected cases in the literature bears an unhealthy resemblance to the upper respiratory tract pathogens of their clinicians. Discitis and osteomyelitis are possible. However, evidence of direct causation in the literature from LP is scant. Persistent low back pain. Radicular pain that persists more than a few days following lumbar puncture is extremely rare. In summary, in this video, we have reviewed the complications from diagnostic or therapeutic lumbar puncture in the ICU. Cerebral herniation remains the most serious of these complications, as well as post-dural puncture headache, bleeding, infection, and persistent low back pain. However, the take-home message is that all of these serious complications are extremely rare in the ICU setting.